This video will introduce you to the new Cobra PLA, a perilaryngeal airway manufactured by Engineered Medical Systems. The Cobra PLA is a new perilaryngeal airway. It was invented by Dr. David Alfrey, a practicing anesthesiologist in Nashville. It is designed to improve airway sealing and thus facilitate positive pressure ventilation. The device was studied by the Outcomes Research Institute in conjunction with the Department of Anesthesia at the University of Louisville. 100 patients were randomly assigned to the PLA or the laryngeal mask airway. In both cases, cuff pressure was maintained at 60 centimeters of water. Airway sealing pressure was 25 plus or minus 5 centimeters of water for the PLA, but only 18 plus or minus 5 centimeters of water for the LMA. This difference was highly statistically significant, with a p-value less than 0.001. The incidence of sore throat and dysphagia was similar with each airway. Tips for use include the fact that about 10 insertions are required to become facile with the technique. Smaller size is usually better. Typically use a number 3 for women and a larger size for men. Deflate the cuff and fold it back over the tube before inserting. Lubricate the Cobra PLA head and cuff, and insert fully. The airway should not be visible inside the mouth. Do not overinflate the cuff. The tube of the Cobra PLA is wider and shorter than other supraglottic airways. This provides less resistance to flow and allows easy passage of a video scope. The Cobra head is wide and it centers the device in the airway, pushing tissues out of the way. The epiglottis will typically be above the grill with the vocal cords opposing the grill. The grill keeps the epiglottis from clogging the distal end of the tube. The tube is soft enough to bend, but stiff enough not to flip over. The Cobra head is shorter and smaller than other supraglottic airways. It is inserted very much the way a laryngeal mask airway is, popping behind the tongue. The cuff is anatomically shaped and seals the oropharynx. It's more effective than other supraglottic devices that seal the side of the hypotharynx. This model shows how the Cobra head and cuff are positioned in the hypopharynx. Note that the cuff is inflated in the proximal hypopharynx, having turned around the back of the mouth and tongue, and that the grill approximates the glottic opening. Because the Cobra PLA tube is wide, you can easily pass an endotracheal tube through it in the case of an emergency. If this is necessary, the tube should be passed over a bronchoscope. A number 2 or 3 PLA will fit a number 6.5 endotracheal tube, whereas a number 4 or 5 PLA will fit a number 8 endotracheal tube. In this case, we see a number 8 endotracheal tube penetrating the grill of a number 4 PLA. Typically use a number 3 for women and a larger size for men. The first step is to check the cuff. After checking the cuff, deflate the cuff completely. Then lubricate the airway generously. This includes the cuff itself, and the head of the Cobra PLA. Afterwards, pull the cuff down around the tube. You will feel a pop as the Cobra PLA head turns into the hypopharynx at the back of the mouth. Insert further until moderate resistance to passage is felt, and then pull back slightly. Inflate the cuff to no more than 60 centimeters of water. Refer to the Cobra PLA tube for cuff inflation volumes. After passing through the tube, the scope enters into the Cobra PLA head. From there, the grill is apparent, and the scope can be passed right through the grill and will usually be opposite the vocal cords. In summary, the Cobra PLA is a new perilaryngeal airway. It can be used to facilitate fiber optic intubation. The cords are usually visible through the grill. High airway sealing pressures are characteristic of the device, and this facilitates mechanical ventilation. Ventilatory inflation pressures should be limited to 20 to 25 centimeters of water to prevent gastric insufflation. The airway is easy to insert and easy to use.